Bismillahirrahmanirrahim. Assalamu alaikum everyone. My name is Maryam Akram from 4th Prof Morning. My roll number is PP1650125 and I belong to group number 17. Today I am going to discuss about my topic, which is deep venous thrombosis. What is deep venous thrombosis? Deep vein thrombosis or DVT occurs when a blood clot forms in one or more of the deep veins in your body, usually in your legs. Deep vein thrombosis can cause leg pain or swelling but also can occur with no symptoms. You can get DVT if you have certain medical conditions that affect how your blood clots. A blood clot in your legs can also happen if you don't move for a long time, such as after you have surgery or an accident, when you are traveling a long distance, or when you are on bed rest. Deep vein thrombosis can be very serious because the blood clots in your veins can break loose, travel through your bloodstream, and get stuck in your lungs, blocking blood flow, that is pulmonary embolism. However, pulmonary embolism can occur with no evidence of DVT. When DVT and pulmonary embolism occur together, it's called venous thromboembolism. Now, as it clearly shows in this picture, the normal blood flow between deep veins. In this picture, it is showing us the deep vein thrombosis, and here it is showing us an embolus. Now, what is the difference between thrombus and embolus? A thrombus is formed in an undamaged vessel, but if it breaks or loose, then travels through bloodstream and termed as embolus. Signs and symptoms of DVT. Symptoms of DVT only occur in about half of the people who have this condition. Common symptoms include swelling of the leg or calf, as we can clearly see in picture number 1, that the swelling may be in your foot, ankle, or leg, usually on one side. Cramping pain in your affected leg that usually begins in your calf, severe unexplained pain in your foot and ankle that may worsen when standing or walking. In the third picture, we can clearly see that the warmth and redness of the leg, an area of the skin that feels warmer than the skin on the surrounding areas. Skin over the affected area turning pale or a reddish bluish in color. The people with an upper extremity of the deep vein thrombosis or a blood clot in the arm may also not experience symptoms. But if they do, then the common symptoms include neck pain, the pain in the shoulders, swelling in the arm or hand, blue tinted skin color, pain that moves from the arm to the forearm, weakness in the hand. People may not find out that they have deep vein thrombosis until they have gone through the emergency treatment for a pulmonary embolism, which is the blood clot forming in the lungs. What are the causes of deep vein thrombosis? DVT is caused by a blood clot. The clot blocks a vein, preventing blood from properly circulating in your body. Clotting may occur for several reasons. These include injury. Damage to a blood vessel's wall can narrow or block blood flow. A blood clot may form as a result. Number 2, surgery. Blood vessels can be damaged during surgery, which can lead to the development of a blood clot. Bed rest with little or no movement after surgery may also increase your risk for developing a blood clot. Reduced mobility or inactivity. When you sit frequently, blood can collect in your legs, especially the lower parts. If you are unable to move or for extended period of time, the blood flow in your legs can slow down. This can cause a clot to develop. Certain medications may also lead to the blood to form a clot. Now, what will be the DVT prevention? As it is a serious medical condition, in addition, treatment may help prevent a pulmonary embolism and lower your risk of having more clots. You can also lower your risk of having DVT by making a few lifestyle changes, like keeping your blood pressure under control, giving up smoking, losing weight if you are overweight, moving your legs around when you have been sitting for a while also helps keep your blood flowing. Walking around after being on bed rest can prevent clots from forming. Take any blood thinner like anticoagulants your doctor will prescribe if you have having surgery, as this can lower your chance of developing clots afterward. The risk of developing DVT during travel becomes higher if you are sitting for more than 4 hours. Lower your risk by moving around every so often. Get out of your car and stretch at intervals during long drives. Walk in the aisles if you are flying, taking a train, or riding a bus. Stretch your legs and feet while you are sitting. This keeps your blood moving steadily in your calves. Don't wear tight clothes that can restrict your blood flow. So now moving towards our case study, which is a patient named Ellen, a 76-year-old obese, having weight 92 kg and height 6 feet tall. Man was admitted to the hospital 3 days ago for management of recurrent angina. He was started on nitroglycerin drip and confined to the bed rest with gradual increases in his oral anti-anginal medications. On the third day of hospitalization, he noted progressive swelling and soreness of the right calf. He denied shortness of breath, cough, or chest pain. His medical history includes coronary artery disease, myocardial infarction at ages 55 and 67, and hypercholesterolemia. His medications are diltiazem, cardizem, which is a brand name, CD 360 milligram per day PO per oral. Isosorbide mononitrate Imdor 120 milligram per day per oral. Atenolol with brand name Tenormin 50 milligram per day PO. Aspirin 325 milligram per day PO, and Samvastatin Zocor, which is 5 milligram PO QPM. Initial laboratory values include HCT 36.5% between the ranges in normal 42 to 52%, PT 10.8 seconds, INR 1.0, APTT 23.6 seconds, and platelet count 255,000 per millimeter cube. What signs and symptoms demonstrated by LN are consistent with DVT? SOAP notes. What is basically SOAP note means? Basically, these are the essential piece of information or a method of documentation employed by healthcare providers to write the health status of the patient. Now, in subjective part, we will note the chief complaint of the patient, which is recurrent angina. The onset of chief complaint is 3 days. Symptoms of the complaint: the patient denied shortness of breath, cough, or chest pain, but progressive swelling and soreness of the right calf is noticed. History of the illness includes the age of the patient, which is 76-year-old, the gender, he is male. Medical history includes coronary artery disease, myocardial infarction, and a hypercholesterolemia. The current medication of the patient includes diltiazem, which is a calcium channel blocker and used to treat angina. Isosorbide mononitrate, which is also used to treat angina pectoris caused by coronary artery disease. Atenolol, a beta blocker used to treat high blood pressure and chest pains. Aspirin is shortly given after a heart attack and used to treat inflammation or pain. Simvastatin is used to decrease elevated lipid levels and heart problems. Now, the objective part includes the laboratory data, which is HCT. HCT is 36.5% and it is usually a hematocrit test. Normal range lies in between 42 to 52%. PT, prothrombin time, which is 10.8 seconds, and the normal range lies between 11 to 13.5 seconds. INR, international normalized ratio, which is 1.0, and the normal range lies between 2.0 to 3.0. APTT, which is activated partial thromboplastin time, is 23.6 seconds and normal is 24 to 36 seconds. Platelet count is 255,000 per millimeter cube and the normal range is 150,000 to 300,000 per millimeter cube. From the symptoms and the lab results, the assessment for the above case study includes: number 1, warmth and local tenderness or pain, and which is usually caused by venous obstruction. Number 2, the patient starts complaining with the sudden onset of swelling along with the soreness but without the evidence of a cord. Low INR values results in the life-threatening blood clot. Low HCT and PT and APPT values indicates that the blood clots more quickly than normal and indicates the chances of deep vein thrombosis. Here in the first picture, it is showing us the normal leg, and in the second picture, there is a leg with DVT, which is deep vein thrombosis. The swelling and inflammation below the blockage site occurs and forms the venous clot. To confirm the physical examination or diagnosis, the test for the DVT includes ultrasound, venogram, or D-dimer test. The ultrasound is the most commonly used for diagnosing DVT. It uses sound waves to create a picture of your arteries and veins in order to see how blood flows through them. If a clot is present, your doctor will be able to see the interrupted blood flow and make the diagnosis. Venogram is inconclusive, and in this test, a dye is injected into the vein and then the X-ray is taken over where the doctor suspect the DVT is present or not. The dye actually makes the vein more visible so the interrupted blood flow would be easily seen. D-dimer test measures the presence of a substance that is released when a blood clot breaks apart. If level of the substance are high and you have risk factors for DVT, you will likely have a clot. And if levels are normal and your risk factors are low, you will not have a DVT. The risk factors for DVT occurs most commonly in the people who are over 50 years of age, but they can still happen at any age. Certain conditions that alter how your blood moves through your veins can raise your risk of developing clots. These include having an injury that damages your vein, like a bone fracture, being overweight, which puts more pressure on the veins in your legs and pelvis, having a family history of DVT, having a catheter placed in a vein, taking birth control pills, or undergoing hormone therapy. Smoking, especially heavy smoking, includes chain smoking, passive smoking, is also a risk factor for DVT. Staying seated for a long time while you are in a car or in a plane, especially if you have already at least one other risk factor for DVT. Some conditions can increase your risk of having blood clots, which include blood clotting disorders, especially when you have at least one other risk factor. Cancer and anti-inflammatory bowel disease can also increase the risk of developing a blood clot. Heart failure, a condition that makes it more difficult for your heart to pump blood, also causes an increased risk of clots. DVT is a major risk of associated with surgery. This is especially true if you are having a surgery in the low extremities like joint replacement surgery. DVT complications. A major complication of DVT is a pulmonary embolism. You can develop a pulmonary embolism if a blood clot moves to your lungs and blocks a blood vessel. This can cause serious damage to your lungs and other parts of your body. Get immediate medical help if you have signs of a pulmonary embolism. The signs include dizziness, sweating, chest pain that gets worse with coughing or inhaling deeply, rapid breathing, coughing up blood, rapid heart rate. Now, the plan for the treatment of deep vein thrombosis on the basis of our assessment, as we have discussed in the previous slides, includes the following medications. The medication that thin your blood, like heparin, warfarin, enoxaparin, fondaparinux, in the given brand names as I have mentioned in the brackets, Coumadin, Lovenox, etc. These all are the anticoagulant drugs which makes it harder for your blood to clot. It also keeps existing clots as small as possible and decrease the chance that you will develop more clots. If blood thinners like anticoagulants don't work, or if you have a severe case of DVT, your doctor may suggest you thrombolytic drugs. People with upper extremity DVT may also benefit from this medication. Thrombolytic drugs work by breaking up clots. You will receive them intravenously. The pharmacological management for the severe cases of DVT includes wearing compression stockings that can prevent swelling and might lower your chance of developing clots. Doctor may suggest surgery to remove DVT clot in your arm or leg. This is typically only recommended in the case of very large blood clots or clots that are causing serious issues like tissue damage. DVT exercise may also be recommended. Ankle circles, knee pulls, foot pumps, these all are basically the exercises which doctors recommended in the high risk cases for DVT. Now, I hope you guys will easily understand what is deep vein thrombosis, what are the signs and symptoms for this DVT, what are the causes and how to assess and diagnose the DVT, what will be the plan and the management for the deep vein thrombosis. Now, I think I have tried my best to explain you guys about my topic. Thank you so much. Allah Hafiz.